my thighs, and my thighs against her back so that she's not rolling back like this, right? I want her stacked, and then I'm going to position myself here beside her. And so normally I start by trying to get some people have a really hard time letting their shoulders go. Okay, so I usually do a little bit of this. And sometimes there are some words that go along with, like, it's okay, let that go, let it relax, good, right? And then I take this hand, and I'm just going to come down, and just like we talked about the other day, if they can get their arm here, great. Very supported here, very supported with my leg, so she's not rolling back and she's not falling forward. She feels like she can just relax her body, and I've got her. And then I'm just going to, and again, I'm thinking about stretching the arm right in first. Not a lot of movement in my arms. Okay, so moving from my hara, hip to hip. And then depending on what I'm finding with the range of motion, you know, I'm going to support the shoulder, and I'm just going to see what she's got. Encouraging them to give it to you, relax, and try it out. So this is for end feel. Slightly stretch. Slightly small intestine. Small bladder. Getting the most access in the shoulder when the arm is in this position. You can do the same thing lying facing down and bringing the arm up, but here you're getting much better perpendicular pressure. Is that okay? anatomically, if you imagine our wings, right? It's like that small intestine is the wing that we have. And so if you think about trauma, and again, we talked a little bit like when we were talking about the DUMI is kind of the avenue where that ancestral trauma can come in, right? When the egg is fertilized, is when the DUMI meridian starts to be formed, and so that is all encapsulated at that time and kind of predetermined. So it's like, a lot of people are born with certain neurological diseases, and they say it's hereditary, but also some of this emotional stuff is hereditary as well. So because of this relationship with the small intestine and the DUMI, a lot of people come into life sort of pre-existing neck, shoulder, upper back problems. And so sometimes these issues that are happening in the shoulder, like people who keep injuring their neck and shoulder over and over and over again, it's actually potentially related to not even their life, like, something that they brought into life with them. So it's a lot, right? It's a lot. And when you're looking at trauma, like I always think, people have their trauma and these things happen in this life, but sometimes it's bigger than that too, right? Sometimes it's like a pattern that has repeated through many generations. So this is like our ability to clear that. And one of the meditations and exercises that my shoulder injury was 100% that, because my mom was exactly the same injury. And so one of the meditations that I did when I stopped physio and I started working was I started to think about my wings and that I was free, that my destiny was my destiny, and it didn't belong to the past, and it didn't belong to anyone in the past. And that's when I started to really connect to the DUMI, the small intestine, and it's literally when the rest of this course got finished, because I was like, this is such an important part of this, because pain, so much of our pain we bring into us in this life, and this is a big part of the pathway of how it enters, right? This is like excruciating, intolerable pain, and almost everyone, it's either in the spine or it's in the shoulders, like, some in the hips, but usually it's the spine or the lower back that leads into the hips. And it was just this kind of major eureka moment. It was like I had to, unfortunately I often feel things in my own body before I really understand them. And so this idea, and I've been, it's like when you were doing that crane exercise today, it was really striking for me, because that's very similar to like the first exercises and movements that I started to do when pain one day. And so treating this is so important. And I mean, it might not be what people are coming for, but I don't think anyone gets away without anything. Maybe some people do, but then they're usually not in your office, right? So it's super important. And to sort of circle back to small intestine 3, I don't actually use small intestine 3 that often. In a case with an acute trauma at that time, I would use it. Otherwise, I work here. I work right here because I want to clear this, I want to disperse it, right? I want to send it out into the universe. And yes, small intestine 3 does help with shoulder pain, but clearing it out of here again, because of that kind of back and forth and coiling in the small intestine meridian, I find that working on it directly is just going to have a better results. And even with Dr. Wong, like channel palpation, he agreed. He's like, he said the same thing. And another thing, and we'll talk about this apart as well, you can do it from here, you can do it from the front, is actually going right in the axilla and basically it's heart 1, so you can get it from the front or from the back. And this also he uses to treat frozen shoulder. And he goes right in deep. Is that painful? In deep in the joint. You find like really the center of the joint and the pulse. And then you hold it for like 5 breaths. So I may as well show the heart while we're at it as well. So if you want to try it back. Treating the heart meridian with acupressure or acupoint therapy, again, you know, we're largely calming, applying a little bit of acupressure to the key points on the meridian. The important thing that I learned through a number of different modalities actually for doing this is that you go right into the axilla at heart 1. So you're supporting both sides of the shoulder with your hand. 5 breaths. Obviously, you want to make sure that the person doesn't have a serious heart problem. And then you proceed to heart 1 is not the point that you would ever needle. So it's a great way to access it, and it kind of stimulates the heart to
Pressure in the axilla is minimal. It's deep. Oh, it's deep. It's deep. Yeah.
you want to make sure you're not hurting them, but
Yeah.
sit up. Is this your worst shoulder? Oh, right. Did you know? Right, now you're looking at what's the worst weekend, so you're a little bit more mobility again.
Just on that.
No?